What was once just a trendy ear piercing has turned into what thousands are now saying is the magic cure to migraines. We have Samantha Smrechniak's story on an unconventional pain remedy and how it's changing one woman's life.
I was flabbergasted. I'm like, I could not believe that something like that could happen.
Ever since Ashley was in 4th grade, she suffered from debilitating migraines, one every week.
I would have to take medication a lot. I would miss out on things because it would be too bright in the places or too loud.
Desperate to find a cure, she took to the internet and saw thousands of people say they were cured by putting a little earring in the smallest cartilage fold of their ear, the Daith piercing.
I was kind of skeptical at first, to be honest.
But she took a chance, and 3 years later, she's still migraine-free.
It was about a couple of weeks, but I had not had a migraine. And I'm like, wow, this actually can be a life. Like, I can live again and not be in pain every day.
We offer styles that can be discreet or styles that can be very seen.
Black Hole Body Piercing in Reno has been doing Daith piercing since the 90s, but never like this.
We're seeing a big increase right now in this piercing, and we stock more than we ever have for it.
And people aren't just loving the pain relief, but the fashion statement too.
It's becoming more mainstream. People are getting it for migraines, but they're also seeing the fashion of what can be worn in it, like moon-shaped pieces, heart-shaped pieces, and they're really getting into those styles.
So what is it that may give people migraine relief? Well, the Daith piercing is able to hit an acupuncture pressure point in your ear that keeps constant compression on that point. Many believe this relieves pain. Others say it's just the placebo effect.
You have kind of this throbbing, pulsating sensation that's mediated by the trigeminal nerve.
We spoke to migraine expert Dr. Denis Patterson to get his take.
It makes sense that if you have acupuncture and you have pressure on that point that helps with your migraines, that you would look at getting something more permanently done like a Daith piercing to alleviate your migraines long term.
He says while it makes sense, there isn't medical evidence to prove it works. He also says there isn't harm in trying.
I think any individual patient's got to look at the risk versus the benefit. If they're in it for the cosmetic reasons, hoping it'll help with the migraines, I see nothing wrong with getting it done. You just need to know that the biggest risk of having it done is infection.
For patients like Ashley, medical proof makes no difference.
Having the piercing, even if it is the placebo effect and even if it is psychological, it has changed my life.
Samantha Smrechniak, News 4.
Your weather